Here's your host for this morning's edition of America's Fabric.
Good morning. I am Dr. Elizabeth Lee Vliet. I am an independent physician in private practice in Tucson and Dallas, and the author of several health books for consumers. My medical website is www.herplace.com. My last show focused on the loss of medical and economic freedom if states implement the new exchanges required under the 2010 healthcare law. In these exchanges, we talked about how you will exchange your medical freedom for more government control. Today, we will be discussing how existing health insurance contracts and the new health insurance exchanges contain clauses that are other ways the health insurance industry interferes with your economic and medical freedom. The issues we are discussing today are the opposite of our American tradition of God-given liberty, the opposite of our tradition of individual freedom to decide how we spend our money, and the opposite of our tradition to choose when, where, and with whom we seek medical treatment, and the opposite of our God-given right to life, when these particular clauses buried in health insurance contracts may actually cost us our lives. I am referring to clauses called enrollee hold harmless that exist in most contracts between your doctors and the insurance plans they may contract with, and between hospitals and other health facilities and insurance plans they contract with to provide medical care. Such language may sound harmless, but they are only holding your health insurance company harmless. These clauses may be deadly for you, as we shall see. I have a guest with me this morning who will help explain this complex subject. Dr. Jane Orient is a practicing internal medicine physician in Tucson and the executive director of the Association of American Physicians and Surgeons. AAPS is the only medical organization in the country to sue to overturn the new 2010 healthcare law, and AAPS has been a voice for private independent physicians and patients' medical freedom since 1943. But first, I'd like to tell you the story of Sandra Lobb. She could be any of us. Tragically, she is dead. She had access to medical care. She had health insurance. She had coverage for the treatment she needed. So what happened? A faceless, non-medical employee of her health insurance plan, hired to review cases and improve or deny treatment, overrode Sandy's physicians and decided, quote, "Given Sandy's age and her condition, the cost of the care being prescribed cannot be justified," end quote. How expensive was her treatment? The particular medical services she needed cost about $7,000. Her husband said he would pay cash for her to have this care. He knew without it she would die. He asked, who among us wouldn't take the responsibility for $7,000 if it meant life or death for our loved ones or ourselves? But what happened next was truly astonishing. The hospital insisted on discharging Sandra when her insurer denied coverage and adamantly refused Mr. Lobb's offer to pay cash for further care. Then, to make matters worse, and to the Lobb's shock, after the insurance company's refusal to pay, no other hospital would admit Sandra. Under the enrollee hold harmless clause, there was no way that any hospital or doctors could be paid for the services. Patients think that insurance companies decide coverage and doctors decide treatment. Sadly, that is not the case. Doctors who contract with insurance companies and Medicare have less and less ability to make treatment decisions for patients. Even though health insurance plans are not supposed to, quote, practice medicine, end quote, in reality, that is exactly what they're doing. Sandra Lobb, in her case, the insurance company decided to terminate her medical care and discharge her from the hospital, not her doctors making that decision. After the insurance company decision, the first hospital received no further payment. The Lobbs tried to find another hospital for Sandra to have her treatment, but all of the hospitals they consulted turned them down and refused to accept cash. Why on earth, in the U.S., the epitome of capitalism and supposedly free markets, why couldn't the Lobbs pay cash for Sandra's needed medical care? Frank Lobb, a businessman, spent 10 years and 5 lawsuits trying to get answers to these questions and trying to figure out how he might have been allowed to pay for his wife's medical care. His book, The Great Healthcare Fraud, available on Amazon, documents what he found and how it can be risky for your life, too. The key, it turns out, is the enrollee hold harmless clauses in insurance contracts. Frank Lobb calls them, quote, the beating heart of the managed care industry's business plan, end quote. It is a secret the insurance industry tries very hard to keep hidden from you, though the clauses are in plain sight if you know what the legal language means and if you know where to look in the contract. And now I'd like to ask Dr. Orient to explain the key concepts of these enrollee hold harmless clauses and how these clauses affect your freedom to pay cash with your own money for medical services you may need. Welcome to America's Fabric, Dr. Orient.
Well, good morning. I think it's very important to remember that we live in an Orwellian world with respect to our use of language, where newspeak things mean the opposite of what you think. Insurance and coverage sound like warm and benign things, and the more you have, the better. And everybody wants universal and comprehensive coverage, thinking that would make everybody safe and secure. That we'd have no more worries about families being bankrupted by medical bills. But there are other more ominous meanings for coverage. It can be stifling, restrictive, and limiting. It can refer to the 6 feet of earth over your grave. And with the health insurance plan, or managed care plan, which is really not the same thing as insurance, the bankruptcy protection is for the plan, not for you. Virtually all provider contracts contain this innocuous-sounding enrollee hold harmless clause. It was written by the National Association of Insurance Commissioners and actually was enacted into state law in most, if not all, states. And officials will say, and maybe they really believe it, that the purpose of these clauses is just to protect subscribers against balance billing. Balance billing means the doctor or hospital billing you for the difference between their charges and what the insurance company pays. But what the hold harmless clause actually does is to serve as an absolute roadblock to prevent providers of medical services from accepting any payment, aside from the deductibles and co-payments, for any service outside the plan for any covered treatment. And a service is covered if it's available under the plan, even if the plan denies payment for it in an individual case like Sandra's. If Sandra had wanted like experimental treatment or something like cosmetic surgery, it would have been non-covered and her husband could have paid.
So even if the insurance plan that we buy says something is covered, they can still deny that covered service for a particular patient. That is just frightening. Why is such a clause needed, and who does it really benefit?
Well, insurance companies will pretend that the hold harmless clause is for insolvency protection. but it's really the insolvency of the health plan, because they prevent hospital or doctor from accepting payment that the insurance company decides is not necessary or desirable or appropriate for a particular patient. So, as Mr. Lobb ultimately learned, it was this clause in the insurer's contract with the hospital that prevented his payment. And he went to court to try to get an explanation of how he could have paid for his wife's care, given the language of that clause.
So it wasn't the language in his contract with the insurance company, it was the language in the hospital's contract with the insurance company.
Exactly. The subscriber never signs this contract with the insurance company and doesn't see it. It is the contract between the provider and the insurer.
And just to be clear for our audience who don't know the terms we live with every day, subscriber means patient. That means you.
Exactly.
So why would a health plan want to prevent a subscriber or patient from paying for health care services?
That really sounds strange, doesn't it? That they would care about your paying your own money? What do they have to do with that? But the fact is, though, and the way it could threaten the solvency of the plan is that the plan has agreed to pay for all necessary and appropriate services. Now, if the health plan reviewer says the medical services are not necessary and appropriate, and then a physician goes ahead and provides them anyway, well, then that's evidence that the plan violated its promise to provide all the necessary care. So what the subscriber might do is to pay for the service and then turn around and sue the insurance company for violating its agreement. Because after all, physicians are not allowed to provide unnecessary or inappropriate services.
So basically, they're covering themselves when they hire a reviewer who says the care isn't necessary and the doctor thinks it is.
Well, and they will claim that they are not practicing medicine when they're doing that. The fact is, though, that they have such control over the physician that the physician will agree with them in virtually every case that this care was not necessary or appropriate.
The physicians, in a way, once they've signed the contract, are trapped because they can be kicked off the plan and lose huge volumes of patients, which could force them out of business. So even though the health insurance plan isn't supposed to define necessary and appropriate care, the companies end up doing it, and the doctors feel they have no choice. Is that what you're saying?
That's exactly right. Now, the physician might well be willing to provide treatment for the patient, knowing that under the contract he signed, he cannot bill for it. However, the other problem is that the health plan can throw him off the panel, or the hospital can throw him off the staff. So it's if he does this all the time, of course, he'd go out of business if he provides care that he can't be paid for. But bad things could happen to him even sooner because the health plan and the hospital.
So if a patient is caught in a terrible trap like this, they don't find out until it's too late. What does Mr. Lobb say that is the reason for all of this, and what can patients do?
Well, they don't want anybody to find out, really, and that's why it took him 10 years of litigation. He's a very persistent individual because neither the State Department of Insurance or the insurance company itself wants patients to understand this. And he felt that the companies steadfastly chose to mislead the court by stressing that the Lobbs were always free to pay for a non-covered service and implying that a non-covered service was something the insurer refuses to pay for, even if the insurance company paid zero. And he said these statements are false or deliberately misleading because, in fact, a service is covered even if they don't pay, as long as it's available under the contract to some people.
So her medical care was covered. They were just saying she was too old and in too poor a condition to justify the cost.
Right, and they're not going to pay for it, and because of these contracts, nobody else is allowed to accept payment. Maybe Mr. Lobb is free to pay, but what good does that do you if the person can't accept the payment?
So it's a good example of how coverage and health insurance and even access to care are no good if you can't get a doctor or a hospital to deliver the treatment.
Well, as our past president Lee Heed pointed out, a key factor in the 3 C's of access to care is cash. The ability to spend your own money to buy a life-saving service. And this is increasingly being denied.
And I think most people don't realize that. They keep thinking, well, if the government controls my health care choices and my treatment's not allowed, then I'll just go pay cash and I'll get it anyway. And I think we're finding in the U.S. anyway that those doors are rapidly closing, and it's time for patients to wake up and realize the threats that they face.
I think the insurance company's counting on the fact that patients want somebody else to pay for their medical care, and they wonder, well, why would anybody be concerned about losing the right to pay cash? In fact, one person even asked Mr. Lobb that, and he said, well, who are you to deny me the right to spend my own money to help my wife?
So he determined that the managed care subscribers can't really contract for the care they need outside of the...
Exactly. And, he points out that the right to contract is vitally important. People say they care about freedom of speech and freedom of the press, but none of these rights really have any meaning if you can't form contracts with other individuals to actually carry out these activities.
So without the right of contract, if we don't have that, then we're really left naked in our dealings with each other or with businesses or institutions, and most importantly, even the government. It's the contracts are the structure that really allow us to manage our life and our family and our all of our dealings every day.
Well, that's right, because you have to be able to rely on other people to provide what you need, and they can't provide what you need unless they are able to accept payment for it.
Well, talk a little bit about how this may relate to Medicare. People think that Medicare is going to be there for them, and we know that the 2010 healthcare law cut $716 billion out of the Medicare budget to serve younger people. How does this other provision affect Medicare patients being able to pay cash for what they may need?
Well, under Medicare Part B, it operates in a rather similar way, even though there's not this enrollee hold harmless clause, that if you are on Medicare Part B and the government does not pay enough to make it possible for hospitals or doctors to provide services, then you really can't get them, because it would be a crime for the doctor or hospital to accept your money. So if the services are covered, even if Medicare says this is worth $0.00, you can't pay for it, which means you can't have it.
And what might happen to a physician who went ahead and did that and provided the service?
Well, if he did that and said, well, we'll just not file a Medicare claim so they won't know about this, and Medicare can fine a physician $2,000 for not filing a claim. I mean, isn't that crazy that it's a crime to turn down a government benefit? And
a crime to not bill Medicare, save them money, and accept cash. This is absolutely an alternate reality universe. It's crazy.
Well, patients are finding out the reality every day if they're a new patient and they want an appointment with a doctor and they're on Medicare.
That's true. It's taking longer and longer to get in because more and more doctors are opting out of Medicare because they can't live by these rules and honor the oath of Hippocrates, focus on the individual patient, and they can't stay in business if the government is choosing to continue to lower the reimbursements for the services that they give. Well, Mr. Lobb's book, The Great Healthcare Fraud, really serves another purpose, I believe, for patients. And what is that in your mind?
Well, one thing that he does is provide these documents that are very difficult to find. The patient doesn't sign the contract, and he may have a very difficult time getting a copy of it so he can understand what's going on. But Mr. Lobb thinks there is potentially a way around this, and that is if a patient can find a physician who's willing to prescribe the care, then the hospital is obligated by law to provide necessary care. And so as long as the patient offers to pay. But then the hospital can't really submit an enforceable bill. So all the patient has to do is write on the bill, this is not a legally enforceable bill. So he gets the service. Theoretically. However, if a physician is so bold as to do that, he is likely to be found to be a disruptive physician, and he can be discharged from the hospital staff and find that he can't work anywhere as a physician after this happens, because managed care and hospitals have such a stranglehold over the provision of medical services that patients are at very grave risk.
Well, this also seems to me to interfere with Arizona's Prop 106, the Healthcare Freedom Act, which guarantees the citizens of Arizona the right to spend their healthcare dollars as they see fit. And I really am concerned that we need people to understand how these issues infringe on the freedoms that our founders thought were so critical to our life and liberty.
Okay, they may not realize that their physicians have signed away their right to accept their money. So what it says in Proposition 106, the physician is just voluntarily waived.
That is mind-boggling. And these were the kinds of things I saw in 1986 when I actually read these contracts, and I thought, I can't do this. I'm selling out my patients. So I've stayed independent, and what we need are more doctors who are independent, and I believe this is the goal of our medical group.
Yes, the Association of American Physicians and Surgeons wants to educate physicians and patients about the importance of staying independent and of directly contracting with each other.
Absolutely. Thank you, Dr. Orient. I so appreciate your coming and educating our listeners today. Last time I talked about the health insurance exchanges, exchanging your freedom for government control. Today we talked about the hold harmless clauses in contracts that doctors and hospitals sign with insurance companies, and how these clauses are used to prevent you from getting the medical treatment you need and spending your own money to do so. All of these are ways that government, state or federal, are controlling your decisions about your life and your medical care. If we continue down this road, we will have limited choices and our medical insurance policies skyrocketing, and we may face premature death. We must return to our core fabric of America and our founders' belief in a God-given individual life and liberty bestowed by our Creator, not by government. Our founders knew, and we must remember, a right that is granted by government is really only a privilege that can just as easily and abruptly be taken away by government. But our founders' visions are being ripped apart by elites now in power who are focused on the collective good, not on you as an individual with God-given rights to live in freedom. Each of us must engage in this fight to preserve our economic, medical, religious freedoms and our ability to live our conscience and determine our destiny. You, as citizens and patients, must be active, informed, and vigilant, and involved in the fight to protect your medical freedom and your life. This is Dr. Vliet signing off for today. Go to aapsonline.org or www.patientpoweramerica.com or herplace.com for more on healthcare ideas on how we can restore America's tradition of economic and medical freedom. Until next time, stay well and live free.
You've been listening to America's Fabric, a radio series on American history and culture, broadcast every Sunday over KVOI, Tucson, and its affiliates. Be sure to tune in again next Sunday morning at 8. Until then, never forget, it's the courage, knowledge, hard work, and respect for truth of Americans that keeps America free and prosperous. America's Fabric is listener supported. To make a contribution, send a check to America's Fabric, Post Office Box 17356, Tucson, Arizona, 85731. That's P.O. Box 17356, Tucson, 85731. All contributions are tax exempt, and every contributor will be mailed a Grateful to Be an American bumper sticker. To get more information on America's Fabric or to listen to previous broadcasts, go to americasfabric.com. That's americasfabric.com.